Hi everyone. Today I'll be telling you about germinal matrix hemorrhage. This is mainly for non-medicos. So what is germinal matrix? This is an area which is located within the brain. Mostly it is present before 34 weeks. After 34 weeks of pregnancy it will not be present. So before 34 weeks if the baby is born, they are more prone to hemorrhage. This germinal matrix, this is an area where there is neuronal cells and glial cells which get differentiated and the brain tissue is formed. From there they migrate to the other areas and brain tissue is formed. So for you people, this area which is located within the brain, it contains thin walled vessels, very thin walled vessels. So for example, preterm neonates, preterm means it's like babies who are born less than 37 weeks, they are called as preterm. Normally between 39 and 40 weeks the babies are born after completed 9 months. So sometimes due to complications preterm delivery occurs where the babies are born before 37 weeks. But this germinal matrix hemorrhage, the babies who are less than 34 weeks, who are less than 1.5 kg, they are more prone. If they are during birth, if they have respiratory distress, for example, there is perinatal asphyxia, hypoxia. This area, this germinal matrix area is more prone to this, and due to the stress, the vessels which are very fragile, they break and the bleeding occurs within the brain. So normally in these babies, they cannot regulate the blood flow within the brain. So what happens? They cannot regulate the blood flow within the brain. The blood pressure increases. Arterial blood pressure increases. This leads to stress and rupture of the vessels and hemorrhage occurs. So what you have to remember is, make sure that your 9 months pregnancy, there are no complications. Have a regular checkups with the doctor, and because the sequelae are very dangerous. There are 4 grades. There are 4 grades of germinal matrix. Grade 1 and grade 2, okay, bleeding will be less, there will not be much complications. Grade 3 and grade 4, the sequelae will be very dangerous. In grade 4 mainly, the hemorrhage occurs within the brain parenchyma. What happens if the hemorrhage occurs within the brain parenchyma? There will be neurodevelopmental delay and cerebral palsy. Baby will have cerebral palsy. And grade 3, there will be ventricle dilatation and there will be blockage of the ventricle. Normally fluid is present within the brain which it circulates, cerebrospinal fluid. There will be blockade leading to hydrocephalus. So these are all complications. Make sure that your 9 months pregnancy period is, you have a regular checkups with the doctor, regular ultrasounds, and make sure that you will not have any preterm delivery. Thank you. Any doubts you can just message. Thank you.